in there. And we had to actually take him and have that clipped for this to close, but we pulled it together, and that's what it looked like at the end. So it's pretty nice healing that you get from the back. They can be bloody, bellies. You see them a lot on bellies. I will tell you, you have to be very careful with the belly because you can create fistulas in the belly. You know, you have the intestines there. It's a suction, so you're sucking all that up, and if they don't have a good muscle wall there, they can create fistulas. So those are the complications. You can bleed to death. You can form a fistula. You can get dermatitis and periwound maceration, which is really, you know, we can resolve that. The first two we can't fix very easily. Excessive bleeding, you can get pain with the removal because, again, what happens is that suction is happening and you get tissue growth that's pulling the tissue. So it will kind of grow into the foam. That is why I had this patient who once wouldn't let us come. She went 2 weeks without a back change. Now keep in mind, we change these Monday, Wednesday, Friday, 3 times a week. And when we're doing it 3 times a week, we're taking it out. And we have people that are crying because it's like ripping and, you know, you're trying your best, but there's not much you can do because they've granulated so much into this. She granulated so much into that foam, they had to take her into surgery and cut all that out. So we had to start again. So your patients have to not miss their back appointments, and they have to know that it's a commitment when they do it to following, you know, the teaching and the guidelines that go with that. So then you have biological dressings. You're going to see these mostly in wound care clinics. These are like Aplografts, Dermografts, cadavers, things like that, and those are put on by a physician. So, and they're expensive, like $500 to $1,000, $500 to $1,000 a pop that you're putting on there. So, anybody have any questions about anything that we talked about today?
Do you put the ultrasound directly in the wound?
On it, yes. Usually it's on intact skin. Because, you know, I told you that they're putting it on stage 1s and deep tissue injuries to try to recover that tissue.
Okay.
So the purpose of why we're doing the ultrasound is we're trying to improve blood flow and the microcirculation right there around that, right? So if you got a stage 1 or a deep tissue injury that's resolving, you know, with ultrasound you can get better tissue, you know, remove some congestion and get better flow. But you also can go around the peri-wound of an actual wound and get better flow there as well. Yeah.
You were talking about the dressings earlier, just talking about them being bacteriostatic. What does that mean?
Okay, so when you talk about dressings, we talk about them in 3 categories: bacteriostatic, antimicrobial, and antiseptic. So the bacteriostatic ones just means they're going to inhibit the growth of bacteria. So they're just not going to create an environment that's friendly for the bacteria to grow. That's going to be like your Hydrofair Blue or that solid gel sheet, the Elastogel I showed you. That's bacteriostatic. So it's not that you're not going to get an infection, and you're not going to do it on an infected wound. But if you have somebody that's at risk for infection, you'll do that because you know it just retards the growth of the bacteria. It just doesn't create an environment conducive for them to grow. Does that make sense? Antimicrobial, you're going to use that when you have bacteria there because it's going to kill them out. Okay? And it's going to deliver sustained kill. So when we talk about that, like silver, it'll kill up to 7 days while it's in there. A lot of these will kill up to, you know, it'll tell you on the package what their kill rate is going to be, how long it's going to do that, but it's going to kill that bacteria that's in there and remove that. Then antiseptic, that's going to be, it's going to reduce just that surface bacteria right then, and that's about all it's going to do. So you're going to get when you think about antiseptics, and here's the difference too, is antiseptics are often going to just, peroxide, alcohol, they're going to annihilate everything right there at that time. And so, you know, I'll just tell you guys, not that I don't use peroxide, but, you know, you have a skin knee, for instance. I'll use peroxide at the initial cleaning, but that's it. I don't use it, you know, on and on and on, because it's going to kill the good with the bad and all of it. And it just doesn't do what you want it to do. Same thing with alcohol. So it's a completely different thing. The silver dressings are by and large painless when you put them on unless your patient's allergic. The honey, however, it just has antiseptic properties and antimicrobial properties. So when you put it in there, for whatever reason with your body, the way that chemical reaction happens, it's going to look like you put peroxide in there. It's not going to bubble, but there's going to be white there like it's boiled out. For whatever reason, it just does that. It does a lot of other things too. it debrides, it, has a humectant effect and all that stuff, so it falls into that category. But the term they use when they describe it is actually antiseptic rather than antimicrobial. Silver is antimicrobial, and the, iodosorb I showed you is antimicrobial. So when you look at their classes, you have to know that. But bacteriostatic is not gonna kill bacteria, it's just gonna prohibit its growth. Anybody else have any questions? Did I change anybody's mind about wanting to do wound care? Nobody? Oh, come on, with the dressings.
The dressings are cool. Very
They
cool.
are very cool. And let me tell you, the thing I like about it, people ask me all the time, is why do you do it, what do you like about it? Because it's like a big puzzle, and I get to take my time, and you get to try things and see how they work. And it really is, the dressings are really cool, because there's thousands of them, and you get to put them in different configurations to see. There's even one dressing, which is super expensive, so I don't get to use it very often, but it combines silver and copper in rings on the dressing. And so silver and copper are what makes a battery, a charge, a negative charge, right? So what happens though is when you put it in there, they're on little dots on this dressing. You lay it in the wound bed, and then when the wound fluid absorbs and goes into those, it creates a chemical arc that's happening, because then the silver and the copper can actually interact. And so then you get a negative charge in that wound bed. Isn't that amazing that you can do that? So there's lots of stuff that they've done. Even the magnets, I think they're kind of cool.
What are your favorites?
My favorite dressing, my all-time favorite dressing, as I told you, is the Mepilex foam. I'm just gonna tell you that it's the best. So like if you're somewhere, which guys probably don't know this, but girls, if you ever worn shoes somewhere and they rub a blister on the back of your heel, they're killing your feet, you're thinking, I've got to have relief. Mepilex foam. They make them in little 2x2s, and you put that over, and it's just like instant relief. The silicone is instant relief. And it doesn't matter what you put it on. If you have a cut, it's instant relief. You put that on there, that for whatever reason the Mepilex works. And then my other favorite product is this one right here. Believe it or not, it goes on everything. I have a 13-year-old kid, and he tells you that that is like the Holy Grail. Now you must keep in mind that in my house, I get sent samples of all sorts of butt paste and everything else. So I have literally a medicine cabinet full of nothing but tubes of this stuff. And believe me, we've tried it all. And so, you have different dressings that you really like. And I like them all for different things. Like I use the honey a lot. I use different ones. It just depends on the wound, because it's not a one size fits all. You can use different combinations, but sometimes they just don't work for patients. Something that works great for somebody won't work for the next person for whatever reason. So, I did a case study that we published for a lady who had mouth cancer. And the other thing about honey is it also stops odor. Her family was just like, we're gonna move if, we can't stand the odor, we can't take this. Something's got to be done. So we had tried a variety of different things, but what kind of dressing do you stick in somebody's mouth? She has a hole in her mouth. What am I supposed to do with that? And every time she breathes, it reeks all around the room, but what am I? So we actually put the honey in, and within 3 days, the odor was gone, and, life was a lot better for them. So it's kind of neat to get to see how you can use different dressings to do different things. Back dressings are cool. When you put them on, you'll think, oh, that's really cool the way it works. So, until you get out there and try them. And the things that'll bother you to start with, they really won't bother you after you get used to it. Somebody will ask me, like, does it bother you to look at butts all day? I don't even register that it's a butt. And I'm going to tell you how bad this is. I asked somebody the other day, she was telling me something about it, and she's like, where this and this was. I was like, no, I don't recall any of that information that you told me. All I looked at was the wound. I don't recall anything about any of the rest of it. So you do get where you just kind of, it just filters out. You don't really think about it. After you've looked at 20 butts a day, it's like, Other than to notice, the things you notice about them are things like, wow, they're skinny. That's a problem. Their nutrition is bad. Wow, they are shearing. You'll notice the things that you need to notice. Any more questions? If not, we're all done.